Alrighty, so ultrasound guided IV access. I guess we'll introduce ourselves first. I'm Jacob Thornton from the ER. Also RN BSN student, and that's why I'm up here doing a class today for the capstone project. I'm trying to get you guys certified too, so y'all will be able to use this for patients. So that's me. I've been in the ER here for about 3 years. I've been in Augusta before that at MCG. That's where I learned how to do this. I was trying to spread the wealth, so that's it.
So I'm Carrie Smith. I'm the interim unit educator here. Been a nurse for a while, since 2001. I can't do the math this early. And I'm excited. I've been a nurse, almost 20 years. And I've never learned how to do this, so I'm excited. Your turn, Karen.
Karen Hill. I'm just a nurse. I've been here for a little over 2 years, so.
Yeah.
I worked at small hospitals before I came here. LPN for 9 years.
All right.
I'm Matt Robinson. I work on the other side. I got Dr. Martinez to teach that class not knowing what I was getting, and he told us what we got.
Yeah.
So I'm glad to get more of a standardized,
better
way to teach this going.
Okay.
And I'm Joe Renner. Been working here a long time, 29 years. And we could stick, but we don't stick anybody hardly anymore. So we kind of need to do this.
I'm Emily Gooch. I graduated school in December. I was less than a year. I actually took the training about 4 years ago in Augusta. But I'm used to it.
Okay.
I'm Chris. Been a nurse for over 2 years. Been here at Regional for almost 5 years as a tech beforehand. So started in progressive care and then ended up in the CLC.
I'm Alex. I've been here for 5 years. I'm excited to learn how to do this too.
Perfect. So I do that just to say, people that have been a nurse a few months. I've had people nurse a few months and nursing for 30 years, all in the same class, and it doesn't really matter how long you've been a nurse or how good a stick you are with this. It's just how much you practice this technique and get good at it. And anybody can do it. Like I say, I've seen nurses that have a shake that can do it. So in Augusta, but hopefully everybody will learn from this class and get confident and good at it. So here we go. So this is ultrasound guided IV class at P-Mines Regional. It's a better solution for nurses with difficult IV stick patients. Let's see if I can get this thing moving here. Whoop. So I have this little magician here on the clip art because some people think it's magic getting this IV ultrasound patients and nurses. It's a fully involved educational tool used to train nurses and staff on how to use the ultrasound guided technique to gain access on the most difficult patients. It will provide the why to using this technique versus other techniques. And things that will be taught in class include the policy, ultrasound equipment, vessel and catheter selection, site preparation, technique for probe, insertion and threading, and potential pitfalls and complications to avoid, appropriate documentation of the IV, and research back in this technique. So some objectives. Upon completion of the class, you should be able to familiarize yourself with the ultrasound machine, describe why the ultrasound guided technique is important for patients, describe the technique for choosing the best vessel for cannulation, demonstrate proper ultrasound cannulation technique, and list 3 common pitfalls and 3 common complications and what to do if they occur. So ultrasound technology has been around for many years, and the use of ultrasound guided access is nothing new to nursing. Training for the technique is hard to find outside of training for PICC team nurses. Lack of training and ultrasound availability has limited the training due to, one, the ultrasound machine being expensive, and an increase for patient satisfaction. Results have pushed this technique further in nursing. And then ultrasound technology is becoming cheaper as far as overall price, and that's helped with the training for patients.
Can I ask a quick question?
Yeah, go ahead.
And it may be kind of silly, but the ultrasound machine we use for centrals, can we use that same machine for this?
That's the one we're going to be using.
Okay.
So,
Okay.
So we're not having to buy any equipment or anything.
Okay.
yeah, we'll pull that in here and go over all the different stuff on the machine. And
Because my next question
be
was
hands-on.
going to be, will we have that up here?
yeah, it'll be hands-on. So
Gotcha.
this is just showing there is a need for difficult IV access patients using this ultrasound machine. These are some common diagnoses that we see every day that have difficult access, and ultrasound IV can be used on all these and many more patients. You don't have to stick them so many times. Nobody likes to be stuck 6 or 7 times trying to get IV or have a central line in their neck. So this will definitely decrease the number of central lines we put in and the number of sticks per patient. And that's the main goals. So ultrasound technology, this is just general knowledge about ultrasound itself. It's a high frequency wave that bounces off objects, creating an image to appear on the screen. Once the wave returns to the probe, it shows the image on the screen. So liquid structures on the screen, they show up as a dark image. So blood going through vessels, that's liquid, it's going to show up dark. More solid structures such as bone, muscle, they all show up lighter in color. Bone is almost bright white, muscle is kind of in between grayish white, and then the blood is the dark areas. So we'll be able to see that in a second on the screen, example of a screen. So tips for using the ultrasound machine: take care of the machine, number one. Don't drop the probe, clean it off before and after each use. You know, it is expensive. It's probably $25,000 machine, so we don't have money to keep replacing stuff on it.
Everybody knows to use the Sony Site wipes. They should
Yeah.
be on the machine. If they're not, they're in that back supply room.
Yep, that's number 3 there. Clean
Yeah.
before and after each use. Ultrasound spray or wipes are okay. No chlorhexidine on the machine. It'll wear the probe down, corrode it, so we don't use chlorhexidine on it. Always plug in the power adapter prior to starting procedures. Battery life can be unpredictable. The last thing we want is the machine dying in the middle of the stick and you have to go find a plug-in. So we'll show you how to unplug it from the charging port, grab the cord and plug it in the room. And then wrap your ultrasound cord around the arm when holding it with a non-dominant hand during the technique. And I'll show you how to wrap the cord around your arm. So if you do drop the probe, it's still hanging on your arm, not hitting the floor. And this prevents the probe from hitting the floor if dropped. And probes can be $2,500 plus each. This is a diagram just showing how you want to hold the probe on the skin. This is the skin here, and this is the vein, and this is your probe. So 90-degree angle is what you want, not this or angle. You'll be viewing, this is where your view will be up here and not below your probe if you have it tilted. So you want it 90 degrees back and forth. So you're viewing directly under the probe itself. And that will give you the best image directly under the probe. So hold it at 90 degrees at all times. This is an image of the ultrasound itself. It's what you'll be seeing once you put it on the skin with some gel. Ultrasound guided IV should be started at 1.5 centimeters in depth and above. So each one of these dots on the screen are 0.5 centimeters. So if you go 1 dot, that's 0.5, 1, 1.5. So I put a dotted line here to say this line or above is where you can start these ultrasound guided IVs. So if this is the vessel, blood, black, if this is the vessel, you could potentially start it in here. You want to follow this up to make sure it just doesn't keep getting deeper and deeper. So start at 3 dots or 1.5 centimeters or above. So that's the most important thing with this whole slide. It's best to place the machine on the most superficial depth possible while keeping this range in view. So there's a depth option on there. Before I even start looking at the patient, I put the depth all the way to the most superficial. And I think it gives you about 4 dots or 5 dots on the most superficial depth on the screen. We'll look at that when we look at the ultrasound machine itself. But this will ensure the image is maximized. It'll zoom in on the most superficial spot and make the vein bigger for you to be able to see it. And depth cannot be stressed enough. Deeper veins may cause the catheter to dislodge from the vein for various reasons. I've seen that numerous times. People start one that are deeper, they're able to get to the vein, they're able to draw blood, but then as soon as they roll the patient's arm back over, it's out. They go to CT.